Hi, so the gait pattern, the abnormal gait pattern that I chose to do was the Trendelenburg and the reason I chose that is because it actually is pretty common in unilateral amputees, tibial amputees. So it presents itself as like that lateral lean. Every once in a while I've seen myself in a video and I'm a bilateral amputee and I see a little bit of a wobble and I get a little self-conscious and stuff like that. So that just means I need to work on it. But this pattern, like I said, will present itself in this lateral lean, and it can be a little bit of a lean, or it can even be like in polio or something like that, where you actually see the person leaning to that first side. So the Trendelenburg side, the positive sign is going to be that. So if it's a right positive sign, you're going to that right leg. If you see a really severe one, like a polio patient, they might actually circumduct their entire leg around to make up for the swing, the hip dropping on the contralateral side. So you're going to see a lean toward that hip on that side, and because the hip abductors are weak, the contralateral side of the hip, the pelvis, is going to drop. So to make up for that, the entire leg has to swing around to make up for it. So I'll try to demonstrate the pattern. Yeah, so a straight on view, lateral view, you're not going to really see much, but the best way to see it is straight on. So I'm just going to back up here. And what you're going to see in my right leg, you're going to see this little lean over. That's kind of exaggerated a little bit, but normally you'll see this in gait patterns with amputees. A really bad one, what you would see is the entire hip circumducting to get around. So that's what I mean, like really severe. Again, you can see this in polio patients. What's the other thing? So to describe it, so the causes of it, weak abductors, obviously anything controlling that. So the superior gluteal nerve will be the nerve responsible for controlling a lot of that stuff. So if you have a pinched nerve in like the L5 region, like that can cause effects on the one side. If you just have weak muscles in general, and then obviously other diseases like I mentioned, polio, you're born and you have a tendency to have weak muscles anyway. So a lot of things. So treatment in this, and I said it in my discussion, biofeedback. So any way you can try to regain some of the brain's ability to communicate with the rest of the body. So they use that with ECGs, any kind of electrical stimulus. They do pressure, like anything to get your body back in control of itself, or to help try to get in control of itself. That would be a thing. And also Pilates, physical therapy, traditional physical therapy. So actually getting down and working the hip abductors to strengthen them, to balance them out, making sure everything's balanced. Not that you have one strong side and one weak side. So those would be ways. So getting on the ground, doing band work, or just doing lateral raises on the ground. You can just use your body weight. So those will be treatments of this. So stronger hip flexors, you should alleviate some of this gait if you have the ability to actually control the muscles. If you have something like polio, that's going to be a lot harder, but everybody's different. It's case by case. So that is my gait pattern, and hopefully you learn something from it.